This is a demo to show some features of a tool in Meditech called the Physician Desktop that'll help organize your day rounding. So let's go into the EMR here. I'm pretending to be one of the general surgeons. Instead of going into patient record the old-fashioned way where I'd look up patients by location or by name, instead of doing that, I'm going to go into Physician Desktop. When I do that, it's defaulted to certain things that are hopefully useful for me. So for surgeons, we generally have it default to outpatient because if patients are coming in for surgery, when they get registered, they end up on this outpatient screen. So your day's organized around your surgeries. Another way to do it, though, is to click on this inpatient button, which will show your patients who've been admitted to the hospital, observation or inpatient. So you can see here that I'm Blake McKibben. And it presents them to you by location. You can also see patients who've been discharged to see if there's something that you wanted to follow up on, a lab test or culture, or see something about the patient who was discharged within the last week. Say you could click on this button. Now let's also come down here and explore this a little bit. This cover selections button here will let me choose other people to be covering for. So I can type in an individual provider's name here. It's defaulted to provider. Type in the person's name and then pick them, or you can do provider group. So let's say that I wanted to cover for my whole group and not just for myself. Let me pick that. I'm going to go ahead and click OK. And then when it presents me with my inpatient list, you'll see it's not just me, but it's other doctors as well. For the purposes of the test system here, we've got one doc in the wrong group, but you get the idea that that's the way to toggle between covering for yourself and your whole group. Let me go down here and do things a little differently. Let's say that the general surgeons are going to be covering for each other now, both groups, so one doc may be covering for both. What we've done is we've created an artificial group here called AH General Surgery, which includes all those physicians. So you can see this is checkmarked here, AH General Surgery. Let me come down here, click OK. And then when that happens, you'll see it's not just me and the other docs in my group, but it's other docs as well. So this is Bill, Falkenberry, and Thompson have showed up as well. So this is a way for you to be able to easily see the patients, your groups, and the broader coverage group. I want to show a couple other features. One is this little icon over here. You can see this sort of profile of a person with a little sticky note, I guess. So let's click on that. So somebody has left me a note saying the daughter can be reached at this number. So this is not part of the medical record as we think of it with clinical data. It is discoverable, so it is logged away somewhere in the data repository, so you wouldn't want to put inappropriate things in here, but it is a way to kind of put things outside of the mainstream of the clinical documentation. Basically, sign out notes is what that's intended for. You can also click on this little magnifying glass here, and that's going to open up the EMR on that patient as a quick way in to explore the EMR for that individual. And then there's also the notepad with the pencil on it. That is a place you can go to write orders. These are basically, this takes you into Palm, so you can do your CPOE orders. And then the last feature I'm going to show you is the print list section button down here. Let's print that. I'm just going to preview it so you can see it here. Printing it would, send it to the local printer. And let's do that. And this is not an optimal list, but it's something we put together quickly so you can have something to work off of. This is a way to create your group rounding list for the weekend. So hopefully that's useful to you. Thank you.